Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut.
Yes.
We look a little different today.
How about these headphones, ladies and gentlemen?
I feel like I could record an album at any given moment because my singing voice is so fantastic.
It's all my fault. I apologize. It's all my fault.
It really does sound amazing.
Or I could DJ. We could start DJing the music into the...
I want to have a full-blown Pink Pony pub and surprise him. Just come in like...
And we have a beautiful new set. In addition to our ugly headphones, right?
I know, we keep adding more. Our second season is just every episode is gonna be something more. We have a TV now. We've got backgrounds now.
More and more official.
We're becoming like an actual podcast.
Yeah, we're becoming professional. We picked up all this extra sound equipment from Jazz Fest. Just kidding.
I was about to say, wait, really? Did you go? Did anybody go?
Go.
You did.
No, I didn't go.
I
didn't go.
You didn't go, really?
No, he ended up. So the rain. One, and then two, he ended up working.
Oh, gross.
Oh, my goodness.
I know.
So you went?
I went on Saturday.
I was so upset.
And I saw Pearl Jam.
Oh, my gosh.
I'm so jealous.
And we took,
Wait. Back up. Okay. What? Because you were like,
yeah,
my wife wants to go to jazz.
I was very much against it. And then, I don't know. We had a little first communion party, had a drink or two. And I was like, let's go.
Let's
pack it
And
up.
on top of that, we took I went with my brother-in-law, my sister, and my wife, and we both have sons that are 15-ish, turning on 16, and we took those two.
How much
So
fun.
my nephew wanted to come. He really wanted to go. And then my son did not want to go. So we took him. And anyone's ever been to Jazz
So
Fest?
you forced them into the vehicle.
No, they came. They both wanted to come. So they're both like, oh, yeah. But my son, obviously, he's never been to a concert.
Oh, wow.
Never had any idea
So
of what he
fun.
was getting
It's
into.
going to be so great. And Jazz Fest at that.
Jazz
Right.
Fest, Saturday afternoon, 3:30, 4 o'clock. So we get there, and there was probably 100,000 people.
Mm-hmm.
And it was not that hot. A little cool front just kind of rolled through. So
Because
it
it rained that morning.
Right before. Yeah. And so we roll up and, it is jam-packed. So luckily, you know how they have those, like, it's almost like rivers in the sea of people, right? So we're in one of those rivers and we just so happen to see a bunch of guys I went to high school with and some of their wives, so we just rolled in with them, right? So my nephew and my nephew has friends that are there. And he's like, my friends are closer to the front, and I want to go.
Oh my!
Go find them. And I'm like, look, this is because it was a very pleasant crowd. It was Pearl Jam.
Yeah.
So everybody there is like 50.
Yeah.
There's no. It's kind of funny.
Age, yeah.
And everybody looks like they just transported from the early '90s. You know,
Right.
it's
like these gorgeous button-up short sleeve shirts. Their festing gear ready to go.
It was kind of funny. So they took off, and I knew that was not going to work. People have been sitting out there since 10:30.
Yes.
Reserving their spots, and obviously it was dense, and we were in the back, on that sort of that back, half of behind the big speakers, and so I knew they were in front. So, the further or closer you get to the stage, the denser and the less uncooperative people get. So anyway, they came back about 45 minutes. And my son was very upset. He was like, it was like hell up there. We kept asking people if we could pass, and they were telling us no.
Yeah. Welcome to the Jazz Fest. But you just got to be tiny and just kind of.
So they did well, though. They, they didn't. I know my son does not like Pearl Jam.
Right.
But he made it
what
through.
Great exposure at 15.
Yeah, and that's what I told my wife
right.
it's a lot. He's not that social, but it's like almost like throwing a crab in a boiling water.
I love
will
it.
Survive or
Get
not.
it.
And we did it, and it was a great show.
I bet.
Oh, he sounded just like
Jam.
it. He played all the hits.
So
I mean,
good.
it was amazing. It was amazing. It was really, really good, and it was sort of windy and cloudy, and it was a real pleasant crowd. And then we had like a 1.5 mile walk to get. My sister picked us up, luckily, and she was like,
That's
sister's a little crazy. It's kind of funny. So we had
I
to
hope
walk.
she's
There's this big
listening.
bridge you
I
got to
know.
walk over, right? And there's this line of people, and people are they're honking their horns. And there's somebody parked right in the middle of the street.
And
Yeah.
it's her.
And it's her. Stop. No.
And you see her like, go around. And we, like, so finally, like, we get within 100 yards, we have to start running. So there's like 15 people are blaring up the horn.
You're like, sorry, that's for us. And she's like, we're running.
And we get in the car, and she's like, I mean, can't they just go around? I'm like, Judy, you are right in the middle of it. Like, not, she's sideways, right in the middle of the street. Like, she came off the main drag and just pulled in sideways.
Wait, if that's not the most New Orleans thing.
Oh, it is.
That is not the most New Orleans thing. Like, what are you doing? I'm just stopped in the middle of the street waiting for
know.
it. It's just
So
like,
good.
and don't care. Just go
Just
around.
don't care. Just go around.
Just
Has
go
her
around.
hand out. Go around. Like, what? That doesn't fly in Baton Rouge. That's only in New
No,
Orleans can
that's
you do
hilarious.
that.
A patient told me,
I mean-
they were at that show and they said Jazz Fest is so amazing because everybody's just living.
Yep.
There's no color.
Yep.
There's no
Yeah.
politics. Everybody's just there to have a good time.
Yeah.
And be. You know?
But
so
you know,
cool.
it's funny. I've gotten older, and I used to love it. I used to go. We used to, as little as in 2nd and 3rd grade, they would put us on a bus and they would bring us to Jazz Fest during
Oh,
school.
my gosh.
You would go to the gospel tent for an hour or two.
Once
and come
again,
back. Isn't that crazy?
only things that would take place in New Orleans.
Only
Like,
in New
kids,
Orleans.
That's amazing.
We're headed to Jazz Fest. Hop in.
And you know, I haven't been there in probably 10 years, Jazz Fest, and it's dirty.
Oh, yeah.
It is nasty. It is.
It's just like that lawyer like described it. He's
Oh,
like,
no.
listen, I don't like Jazz Fest. I'm just gonna say it. And
It's
he's like, I
surviving.
just don't. He was
Yeah.
like, don't love it.
I'm not gonna. It was great though. It really. The
Can't
program
take
was
New
awesome.
Orleans out the boy.
No, you can't. You
No,
really can't.
you'll definitely.
really
I
can't.
mean, but I think that's fun. Like bringing kids to concerts.
Yeah, that's
amazing.
Oh yeah.
Amazing.
Yeah. No, it was definitely good. And that's what I told my wife. I was like, look, I don't want him to go someplace and go to a concert and not know what to expect because it doesn't get much crazier.
Right.
It wasn't
No.
crazy.
He's
but it
prepared
doesn't- Yeah.
for-
I mean, that's
yeah.
a shocking environment for somebody to navigate and weave and.
That's a little different. I mean,
you know,
yeah, like
all
that's
the
different than
substances
like a,
in the air, the drinks, the dirt, the protection of your little island, of your little tarp, your little seats. I mean, there's a lot
Jeez.
going on, right?
We took our kids to go see. This is one of those parental decisions that you're like, was it the best?
Right.
We took our 5 and 3 to go see the Foo Fighters
Ooh.
at an
Dave Grohl.
an outdoor amphitheater.
Okay, that's intense.
It was
Yeah.
the most amazing thing. They had the best time in the whole time. It was like this huge grassy amphitheater.
okay.
And
done.
they ran
Scheduling a
around.
concert.
There was like lawn chairs that you put up on the grassy thing, and I'm like, they loved it.
Yeah.
Now they're like, let's do concerts. I'm like, yes, let's do this.
What are we talking about today, guys?
Oh, okay. All right. So today is it's more of a female.
That's right.
It's a female issue that we have today. We're going to talk about labiaplasty.
Yes.
Labiaplasties.
Yes. So
I like
what
the topic,
is-
comfort and confidence, the
Yes.
truth about labiaplasties.
So, for people who don't know, labiaplasty is a operation
Yes.
that is done by a surgeon that is going to. How would you say? I'm like,
I want you to talk about the
I would say
science
reduce.
or like
we're-
anatomy.
Dr. Gear is going to be joining us after the break, and she's a female board certified plastic surgeon, one of my partners, and we're bringing her in for the female perspective. So, because obviously I'm a male and I don't have a vagina, and I don't have any labia, but I do labiaplasties, and so I think genital surgery is always a little controversial, right? Whether
Yeah.
or not you're, and maybe one day we'll talk about like penis surgeries where like it's penis fillers very big these days and things like that. And there's not a whole lot of scrotal surgery going on, I don't
Yeah.
think. But labiaplasties essentially is
Scrotox.
yeah, they have scrotox. You're right. They do have scrotox. But labiaplasty is essentially the female anatomy is there's the hair bearing area, which we all know, right? And then once you get there's the labia majora, which is the larger fatty sides, the pads, I would say, on the sides of the vagina. That's labia majora. Inside of that, or as you move more towards the center, you have the labia minora, which is the sort of ridge or layer of skin that surrounds the vaginal opening, right? And then at the top of that, you have the clitoris, right? And then you have a clitoral hood, which is an extension of the labia minora that covers or protects the clitoris, similar to male anatomy with whether or not you've had a circumcision or not.
Yes.
With the excess skin. So labiaplasties are a removal primarily of the labia. Let me rephrase that. Not a removal, or a trimming or a decrease in the amount of the labia minora, mostly.
The smaller inner lip.
The smaller inner lip of the vagina. Now you can do labia majora reductions, and you can do clitoral hood reductions, and we'll talk about that. And Dr. Gear, we'll get a little technical with her when she comes in. But
Which is so wild because at Rejuvime we'll do the labia majora filler.
Correct.
Yeah.
Yes.
Yeah. So
it's like you can go either way here.
Yeah.
It's, think of it like breasts almost. Like, so, everybody's vagina area looks very different, right? And so you always want just anatomy. The labia majora is filled with fat. It is a natural, just like you have pubic fat on a man, it's a natural cushion for sexual intimacy and reproduction. And so it's also...
And just comfort in underwear,
and
honestly.
comfort, and comfort. But it's supposed to be full, plump, and fatty, right? It's not something that you want skinny and hanging, right? So Taylor does a lot of, not a lot, but you do filler or fat into that area. You can have excess if you're a massive weight loss patient.
Yeah.
Could have been really big, and as you lose weight, it shrinks.
Which is like the same thing. It's anywhere on your body. Big, shrinking, same thing.
Right.
Correct.
But labia minora or labiaplasties is really not necessarily due to weight loss, weight gain. There's lots of factors that can cause it. Just genetics. Some people are born with more labia than others. Some people have different ideas of what they want their labia to look like. Some people have comfort issues. Some people it's more appearance. It's more preference. There's a lot of different things.
I think you say beauty's in the eye of the beholder.
Yeah.
There are a gazillion different vaginas, and everybody has a different opinion. I remember this patient came to Hammond years ago, and she had a very large labia majora, but that was her self-confidence was coming from her vagina. And I don't know if she, did something to where it was publicly seen or something, but she had a large outer lip and wanted it.
No one's questioning what others are
huge.
doing.
Yeah, I don't know. I didn't ask questions.
I don't know. There was
like
OnlyFans around back then?
Yeah, probably not.
We
But
do have OnlyFans patients.
so I think every vagina is different.
I think you're right, Taylor. So I'm not trying to be weird or dirty. I see a lot of vaginas. I do a lot of tummy tucks.
Yeah.
And it's not weird because
we see vaginas.
He's a doctor. A breast is a breast.
Right.
A vagina is a vagina.
That's why I never thought in like nursing school, and I'm sure like in med school and stuff like that. All of a sudden, I was like, when you go in, you're like, oh, I'm gonna be a nurse. I'm going to be a nurse. I'm going to help people. I'm going to do things. This is going to be amazing. No, you just see naked people all day long, every day. Different naked people. And that's what it is. It's just
the body.
Naked people. And then it's just a thing. Like you're so desensitized
Right. It's the body.
to it. It's just
because you're taking care of the body.
Yeah.
And I mean, almost all the nursing, a lot of nursing students are younger females, and there's a lot of penises and there's a lot of vaginas, and because they put a lot of catheters in, so you're grabbing a lot of penises. You're
that's
grabbing,
it.
It's
Things
just the way
that you never
is.
thought you would be doing.
Would you compare a circumcision to a labiaplasty?
So circumcisions are done, and they're very, very common, right? And the reason circumcisions, in my mind, occurs because if you have a circumcision, you do not get penis cancer. Okay, so it's a Jewish tradition law. You can debate for years about where it came from, but it is a functional procedure. Do you have to do it? No. Is it a little bit hotly contested these days? Yeah.
Is that why they started doing circumcisions
we
when you were little?
Because of the constriction that it can cause. That skin, and also if you have a circumcision, you do not get penis cancer.
Which is wild. That's wild.
Yeah, isn't that wild? So
that's wild.
Yeah.
I didn't know that.
Yeah, so there's a good, a lot of what traditions are based on. Traditions come from necessity, really, right? And so we believe that's where circumcision came from, and hygiene and things like that. So labiaplasties, there are vulvar cancers. There are you can get vaginal cancers, that they're rarer. There's no correlation between labiaplasties and that. It is more, there is like the sexual mutilations that go on in Southern Africa and things like that. Those are more to take away the pleasure. So that's more of like a clitoral scarring and issues. Yeah. So labiaplasties.
I feel like it's more aesthetic.
It is. And I'm going to give you some statistics.
Oh.
All right, because I researched this. So back in 2021, there were 164,000 labiaplasties performed in the United States. That's an increase of 73% from 2015 to 2021.
73%.
Yep, and it's gone up 36% from 2021 to 2024.
Wow.
OnlyFans.
Yep, the average age is 19 to 34.
Wow.
Okay, it's got a very, very high patient satisfaction, which is above 95 to 98%, depending on what you look at. Mostly, when they interview patients, it's mostly cosmetic. There are some functional and concerns that are done with it, but it is mostly cosmetic. Porn is not the number one driver, so we'll talk about that. So when they interview patients, and I'm not sure how many interviews, it's got to be over 100, only 11% said they were influenced by watching porn.
Oh, really?
Yep. And which I think is amazing. So, but I do think that we are in a world where we are much more aware of our bodies. And I do think that we all hold, and I'd always use breasts as the perfect example. Some women love large breasts, some women love giant breasts, some women love small breasts. And men also, right? We couple right together, and some men want the world's biggest breasts, some men want the world's smallest breasts. And it has to do, like you said, with the labia.
Yeah.
Some men like a lot of labia. I'm not trying to be weird. I had a friend that loved a lot of labia.
Yeah.
He used to talk about that. And then some people think labia is horrible.
Yeah.
Right? I want to,
Well, it gets the bad rap. It gets the bad rap. Like, I don't want to say it gets the bad rap, but like everybody makes fun of, like you were saying, you were listening to some podcast, and they were, there's obviously a ton of derogatory terms out there. When you're talking about people who have excessive.
Who's going to say those derogatory
terms?
That's it.
So, but I mean, look, Taylor.
Beef curtains.
Beef curtains.
What was the other one?
The other one, wizard sleeve. That was the one that I heard on the podcast that I was listening to the other day.
I've never heard that. I've heard a lot.
But that's what, so it's like, I think it has this negative,
connotation.
Yeah, this negative connotation around it
Yeah.
because of all of these, derogatory terms. But I do think, going back to like the title of this podcast, comfort and confidence.
Correct.
I think it's confidence that people are looking for if they're embarrassed, just what they think their vagina should look like.
Yeah. And one thing that I've seen a lot with you is that it can be one-sided.
Oh, yeah.
Very
One-sided.
common to just have one-sided labia
They can
minora
have
that needs to
hypertrophy
be
or growth or a much larger labia on one side. And women can be self-conscious about that. And we're all aware of our anatomy, right? And, just like one breast is usually bigger than the other breast, just like one testicle hangs lower than the other testicle. One foot's usually a little bit bigger. One labia is almost bigger. And it could be dramatically bigger in some ladies, and that can cause anxiety and discomfort.
right.
Yeah.
I do think some of the negative. So I think some of the negative connotations are also I don't know how to say this, like enhanced, or plastic surgery 20 years ago, or even 10 years ago, was a male dominated field, and I think there was a lot of like they're just doing it because of porn. Men. Like,
Do you think a labiaplasty has a negative connotation?
I feel like it did.
Becoming more and more accepted
yes,
and normal.
I feel like 15 years ago.
I mean, the statistics show it.
Yeah, there
right?
was I think people go like, oh, you don't need that. Even aesthetic plastic surgeons, and now there's guys that specialize in men and women surgeons that specialize in genital aesthetic surgery.
Well, I mean, not to even mention, so yes, for the appearance, but if it's a true overgrowth of the labia minora, you can have chafing.
Yeah.
It can get in the way
Discomfort,
of intercourse.
like-
You can see it in your clothes.
Yep.
I mean, so I think the negative connotation is kind of silly, honestly.
I did a monsplasty yesterday, which is where and she came in and her biggest complaint was when she wears bathing suits and she wears obviously yoga
Tights,
pants.
yoga pants, yeah.
Whether they're in or out, I can't keep up. Short jeans, who knows? But
skinny jeans.
Skinny jeans, wide leg
boxer
jeans, I'm not quite
like,
sure. Boyfriend cut.
Yeah, boyfriend.
All the things.
You're like a 12-year-old girl wearing your 40-year-old dad's jeans. I don't know.
The worst.
There's some bad styles out there. But anyway, so I did a monsplasty because her biggest complaint was when she is in clothes, she feels like her pubic area falls. And she has a large labia minora. She's also lost a lot of weight, so her majora is also probably larger than average. But we actually made an incision like in her pubic hairline just to pull things up.
Yeah, you have to say what the mons area is.
I'm sorry. The mons is sort of that fatty pubic mound that's covered with hair in the sort of front portion that you see.
Yeah, it's the
when you're
highest
standing,
portion
right?
of
the pubic area, right? Right. So it's actually like above your vaginal
So if it
opening.
protrudes, then it can kind of look like a penis if you're wearing, I mean, like a mound of something.
Yeah,
Yeah.
no,
In the
absolutely.
area.
Women come in. It's a big issue with women that lost a lot of weight, and they always
Yes.
joke and say, "Dr. Weiler, it's like I'm packing down there."
Yeah.
I'm packing.
Fix it.
Fix it.
Fix it.
So you did the mons and
Not
the
the
labia.
labiaplasty. Not yet. So she
Okay.
wanted to start with her, and this is like, so if she, my recommendation, I gave her my recommendation, but she wanted to try this first because in her mind, her biggest issue was that her mons and her pubic mound is pulling down. So she wanted to remove some and pull it back up.
And that was liposuction and skin excision?
Just a pure skin and tissue
Okay.
excision.
Okay.
She had lost a lot of weight, so she really didn't have a whole lot. So
Of
we
fat
just took
to
out
just
to
kinda
fat to suck
pull
out.
it
But so it's like one of those things. It's like and you may get heat for saying this, but like some women come in like with breast reductions, right? Some women come in and they want a breast reduction, and a breast reduction is a fabulous, amazing procedure. But like to the common man, like this woman may have the world's most perfect breast if you like big breasts, right? And you're like, this woman has perfect D, and why would you want to do anything to this, right? I mean, my God, women pay to look like this, right? Well, a lot of it is just what you want your body to look like.
Right.
So those ladies want a smaller chest. And so it's the same way with
It's also,
labiaplasty.
it's like in the shoulders. Like the shoulders. You
Oh,
know,
yeah,
like
for the
bra
big
straps
breasts,
and stuff.
Right.
And it's like
Right.
all the guys are like, oh,
Yeah.
you don't see it. Like,
Yeah, but he's
oh my
saying
God.
just strictly size.
Yeah.
I
Yeah.
mean, you would
Yeah.
think, oh my gosh, you have the perfect breast. But
Yeah.
But everybody has
Everybody.
has different appearance or idea of what they like.
But going back to just strictly a labiaplasty, that doesn't have, I would say it's not a big deal because it doesn't have to involve a whole genitalia change surgery. I mean, it's literally a skin excision.
I agree. I think it's got
Right? I
in the right hand, performed by somebody who knows what they're doing,
Oh, yeah, obviously.
but it is a very, very safe skin excision.
Yeah.
You're right.
It almost sounds like it's a very low risk. Like it's.
So this is what I would say, and we'll talk about that with Dr. Gear. So if it's done improperly, it can lead to a lot of problems.
Really?
Yeah, because, and we'll talk about this third, but the vagina is an opening. It's a hole, essentially, right? And then you also have the clitoris above it. So the labia were sort of anatomically there to sort of protect it a little bit, almost like doors or flaps, right?
Curtains, if you will. Is it?
So
I have to look up what I was thinking.
That's what I'm like.
but so it's there for
Like
a reason,
gine.
right? Now you
Beef
don't
curtains
have to
versus like gine.
Like-
Like gine is like, line gine is like a normal, boring vagina. Beef curtains is like the extra. There you go.
What is. Wait.
seeing a side of you, Taylor. I didn't
Okay,
know
sorry. I
existed.
know. My face is probably 10 shades of red.
Then this was the last podcast that Taylor decided to be. She's like, that's it.
Okay,
I'm out.
sorry. Continue on.
But no. So all right. So you can minimize the labia, but you have to have labia.
Yes.
So you don't ever want to fully remove it. And then the other thing is that you don't ever want to create a circumferential scar, like a circle around the vagina. So because that can constrict and make sex or any type of penetration painful.
Too
Yeah.
tight. Yeah.
And can make anything painful. It can cause just normal pain without sexual activity. So you have to just be careful to just remove certain areas. And then if you're doing like a clitoral hood reduction, you can't connect the two. And then you can't ever want to make a circumferential circle. And there are, anybody with a medical license can do anything they want in their office. So there are fools out there that do that.
Yeah.
And so
a very meticulous surgery.
It's a very precise. You're exactly right.
Precise.
You have to be very precise.
Very precise.
And you have to know your anatomy. You have to be very comfortable with it. And then in that hands, it's very, very safe.
Okay. So with patients that you've had, that you've done this to, that they've had this procedure, is it afterwards, is it just that like confidence boost that they're like, okay, now I'm comfortable?
I think so. I've done them,
I would say half is functional too.
Yeah, I think so. A lot of women come in.
Well, just comfortable like all around now. Not just with looks, but like just
clothes is a big issue.
Yeah,
right. How they're clothes, because we I think yoga pants started.
Correct.
10, 12 years ago, like super big.
Yep.
And they're pretty revealing, yoga pants, right?
Yeah.
So if you have a big mons or you feel like you have a big labia, you can see a bulge down there, and women don't like that. Bikinis and swimsuit bottoms. I've heard patients coming in, they work out a lot, chafing. With like a lot of these Orange Theories, or you can get on the bikes, so that some sexual comfort. Women comfort level, and then aesthetics that they want smaller labia. Weight loss patients as we get into this, Ozempic, GLP-1 stuff. People losing a lot of weight. Gastric sleeves were huge, and we thought we were going to see this rush of people. We saw a good amount of patients from gastric sleeves, but gastric sleeve was done more for these morbidly obese. Yeah, and we're now these GLP-1s. We're having patients that are just getting thinner but a lot of it is we fill labia minora, right? I mean,
majora.
Both labia minora can be filled too.
Okay, I've never done that.
I was going to say I don't think we've ever done it either.
Yeah. So it's like everything else. You want some fatty tissue around your vagina. You want it around your labia. So you can fill both the labia majora and the minora. We don't do a whole lot of minora, but you can.
And I want to talk to Dr. Gear too about overall sexual enhancement with. You said the minora, you can feel the majora, and like the clitoral hood and all of that. She knows. Yeah. I'm excited to talk to her about that.
So, unless anybody has any more.
No, let's bring her on.
Let's bring her on.
Let's bring her on and get into it.
Taylor, you have more stuff you want to tell us about.
You are names. Now.
Dr. Gear is very comfortable with all of this, so she is going to bring a different.
the vagina nickname expert, Taylor Besh.
It's like one of those things when I went to Catholic school, and we were like 8th grade or freshman, right? And so we were going to talk about sex, right? And so the guy he was kind of a hippie, kind of funny. So he's like, all right, for the next 5 minutes, I want everybody to yell out every dirty word and funny, So you're like, yelling,
just like all of that.
Like, get it out of your system.
Just say it.
I hope y'all have gotten it. No, we'll get it out of our system when Dr. Gear walks in here.
That's fantastic.
But as we move to break, we want to thank our sponsors, as always, right? We want to thank Weiler Plastic Surgery Group, the largest aesthetic cosmetic plastic surgery group in the state of Louisiana, with 5 surgeons, over 12 injectors, over 11 locations. We are South Louisiana's premier provider. We also want to thank Rejuvime Medical, Louisiana's largest anti-aging organization. We provide hormone optimization, right? Testosterone replacement, GLP-1s, and aesthetics. And we're located all throughout the state of Louisiana and southern Mississippi. Stay tuned. We'll be coming back with Dr. Gear.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters. We all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. The college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
Hey everyone, welcome back. We have our expert with us. Dr. Gear is joining us. Thank you so much for coming to sit with us this morning and talk about labiaplasty.
Yeah, thanks for having me.
All right, so tell us a little bit about yourself.
Well, my name is Dr. Gear. I am a board-certified plastic surgeon from Baton Rouge. Grew up
Born and
here.
raised, right?
Born and raised in Baton Rouge. Spent a lot of time in New Orleans and a little bit in Mississippi and Texas for my training, and then found my way back home.
How many children do you have?
Because it's impressive.
5 that came out of me. 7 if you count my 2 older stepdaughters as well.
That's amazing. You're
She
kind of like
is
a Wonder Woman.
literally Superwoman.
Yeah.
She's a full-time plastic surgeon, 7 children.
7 kids.
Her husband works in New Orleans. She is
He's a vet, great guy.
legit amazing.
I'm just sitting here thinking, so right now, everybody talks about, Maycember, because there's 14,000
Yep.
things that you
Oh
have
my
to go
gosh.
to. And I only have 2 kids. And the amount of things that is on my calendar in like the next couple of weeks for the end of school and May crowning, Mother's Day, Challenge Day, Water Day, all that kind of stuff. I don't even, is there a calendar big enough to put all that stuff in?
I'm not much of a calendar person. I have to get one out for summer camps because that just gets a little too crazy to coordinate with 5. You just learn not to sweat the small stuff.
Yeah,
If
that's good.
everyone's alive at the end of the day, it's a
We've
win.
done well.
Yeah.
And I miss a lot of stuff. I'm late like I was this morning.
Hey.
That's all right.
But you just have to get it done.
That's mama's. That's mama's. I've ran down the street like holding one of my kids to try to get out of school. I'm like, come on. Like I can't imagine.
So, Dr. Gear, tell us your stance on labiaplasties.
So current stance is I'm fully on board with labiaplasty, but that was not always the case.
Oh, really?
Okay.
Yeah. I had a lot of reservations, I think, because of some to do with things that I inherited from training and others to do.
Okay, that's what he spoke of. What do you mean by that?
Well, I think they weren't trending, and they fell out of favor, I think, a lot in the OB world. And for me, it was, what are the motivations? Why do we see
Right.
so many women who want labiaplasty? And that was a big concern of mine because I'm in the business of making people better, not giving people new issues. And you're talking about a very sensitive area that's highly functional, important for, not only, female self-confidence, but intimacy. You got to urinate, you
Yeah.
got to wear clothes,
Childbirth.
Childbirth.
So if you're
It's-
younger,
Wait,
yeah.
was this an OB thing before it was a plastic surgery thing?
It is, and it has
That's
fallen
okay.
in and out of favor. And I would say
Okay.
probably a lot of patients come to us because it's kind of frowned upon, or at least has been in the OB-GYN literature.
Really? Okay. I didn't even think about that.
I
I didn't
didn't
even
know
think
that
about
either.
this being like an OB thing prior to.
Anyway, but so
Okay,
I think,
yeah.
I think maybe with social media and smartphones, there's just so much more out there, pictures and things. And I think for me, the big thing is there is no normal down there.
Right, we were talking about
And
that.
that's really important because
Right.
these patients come to us and they think that they have a problem, and it's like, well, you don't actually have a functional problem or abnormal anatomy, but these are the changes we can make. And most of my labiaplasties, I think, are in women who I feel like have some issues. They're not just trying to get like a porn star, but
Yeah.
as
Yeah.
we say.
Yeah.
That's
And
I mean,
I'll kind of chime in. I was explaining earlier. I talked about like almost like breasts. Like so, beauty is in the eye of the beholder. And I tell patients all the time, if you want I'm here to make you happy. So there are people that don't have breasts, right, and they have like a true functional, issue genetically. But it's really if you want big breasts and it's safe and I can do it, I'm happy to give you big breasts. If you want the world's smallest breast implants or want the world's smallest breasts, and that's what makes you happy, I'm happy to do it.
Yeah.
And I think you're kind of along the lines with that. I think as surgeons, we were trained, 15, 20 years ago, it was, oh, this is a lot of porn influence, or hey, this is, and I think now we're more of, it's personal confidence and it's personal satisfaction.
Right. And my experience has been that patients are really happy. But I think it's about picking the right patients too.
Do you see that he said statistics?
So, I had some
79%.
statistics written down. I was saying, so the average patient's 19 to 34. They have a very high satisfaction rate, like you said, above 96 to 98%. If you would poll these ladies, only 11% said they were influenced by porn. The other ladies said it was mostly, there are functional issues, but mostly just personal satisfaction and personal appearance.
Yeah, I think they kind of fall into 2 categories, especially the younger ones. They feel like they always had a problem. They were in gymnastics, or they swam, or they wear athletic wear, and they feel like they were different, or they couldn't hide the labia in their clothes. And so they just, almost as a child, had more awareness of it than their peer group. And then the others are going to be postpartum women who feel like they have changes.
Right.
And so those two I find do very well.
Do you feel ladies come in with sort of like, I have a lot of guys, gynecomastia, that come in, and obviously it's bothered them since they were 10, 12, right? And they may be 50 or 60 now. Do you feel like that way with women sometimes, and they act earlier, or?
Definitely. I think, especially in young women, it's just means. It's, reaching adulthood is important. I wouldn't do it in adolescence. And then I prefer patients who are sexually active and have some idea of what their sex life and how things work down there are, because you don't want to intervene and then them have an issue and them not know whether it's related to surgery or other things, and that's a whole complicated thing to get into. But yeah, certainly I think for me, there's more and more women who meet criteria.
What else, other than obviously the skin excision of the labia minora, do you think is important? Or do you do filler we were talking about filler in the majora, clitoral enhancement, anything like that?
Yeah, so look, personally, I haven't had a lot of interest in that, but I think there's probably, the reason these things are out there is there's probably a place for all of them. The truth is you can overhaul the entire, the mons, the labia majora, the labia minora, the clitoral hood, the perineum. You can do vaginoplasty. That's a whole other kind of side thing. And I think in some patients, massive weight loss patients, there's probably a role for that. You can do a lot of remodeling down there, and then you still need some volume for comfort and for looks.
Yeah. Who would you say would be your ideal patient for a labiaplasty?
Well, just for our viewers' education, talk us through.
What is
what it is and how you have this discussion with patients. Does that kind of make sense? Sort of. It's a vague question, but.
So just labiaplasty in general?
Right. Yeah.
So the majority of the time, when patients come in looking for labiaplasty, and the ones that I see, we're talking about the labia minora. And these are women that feel like they have a lot of redundancy down there. It hangs past, the vaginal cleft. Most women want a single cleft, or to feel like things are kind of tucked in there and they don't hang down. The labia minora, I believe, are analogous to the scrotum in men.
I think so.
Which is why there's often color change, and it's kind of like, do your balls hang low? Like they come in all.
Do they wobble?
They can be nice and they can be nice and tucked in there. They can hang down. So that's the first thing.
Old man.
And look, I have 4 girls at home, and I can tell you there's a wide variety of anatomy down there. So that's the first conversation I have. There's actually a table book of vaginas I tell some people to go get.
Really?
I don't have it, but it's just for that purpose, to just talk about how varied the anatomy is. And some women are like, oh, I didn't know. I just thought it was really different.
Yeah.
And then, anyway, but so most of my patients, we are talking about trying to trim what you consider labial excess compared to, and just get the structures flush. So that, but the biggest complaints they have are, my labia stick to my underwear. Probably more often than that is discomfort with intercourse. Tugging is probably the number one thing.
How about asymmetry? Do you see a lot of asymmetry?
I've seen asymmetry. I've actually done unilateral labiaplasty for patients who just have one that seems to be more significant. And this is, all comers, like women late in life are like, this has always bothered me. Like, I've got a divorce or whatever, and I'm ready to fix this.
Yep.
Huh. Love that. Now can I ask the ideal candidate?
Yeah.
Okay. He shut me down.
And let me
follow
that.
Your ideal candidate.
Let me follow that real fast. With most of my labiaplasties are what we call trim labiaplasties, where you're just tailoring and trimming the labial excess. But like everything in plastic surgery, there are multiple ways to do things, and each have their pros and cons based on the anatomy.
So if it is strictly a trim labiaplasty, it's, in easiest terms, it's literally pulling down the skin and trimming it, the excess, and then stitching it?
Yes, but nothing in plastic surgery is
straightforward,
easy,
right?
So first of all, like a haircut of your labia, but no.
No one, even youthful, super healthy patients, have this robust, thick skin down there.
Right.
It's like sewing a little bit on tissue paper. It's very wrinkly. People who want labiaplasty and want things to be as pretty as possible, they're looking. And then there's muscle there too. It's very vascular. So it's not quite as simple as just like,
a trim.
Tuck.
Yeah. Okay.
Yeah, I was talking earlier Dr. Gear. I'm Dr. Weiler, Dr. Gear, so we'll be formal.
Yes, Dr. Weiler.
It's important that you know what you're doing, because I was sort of explaining in layman's terms. It's the vaginal opening is round. You don't ever want a circumferential round scar around it, so you have to stay to and it's difficult. There's a lot of redundancy down there. There's a lot of tissue folds and
anatomy varied, like
anatomy.
around the frenulum
Right.
and the clitoral hood.
Yep.
It's like its own little roadmap in
Yep.
every person. So you really have to pay
You got to be
attention
precise
to
where
get
where you're cutting, or else
correct.
you
Or
end up
you
with
can
scarring
create
in the
these
wrong.
weird webs and asymmetries.
Yeah.
Wow.
Do you ever do clitoral hood reductions at all? Is that something you've gotten into?
I'm not opposed to. It's not something that I highly, unless they specifically ask about it. It's not something that I usually put out there
Right.
unless I feel like it's really necessary.
Right.
Obviously, the clitoral hood carries with it a lot of other concerns, right? And so I think if if your sex life is okay, if you can have an orgasm, sometimes it's better. The enemy of good is better. But it's certainly on the table, and I think there's some tailoring there sometimes that lends itself nicely with the labia on occasion.
Yep, totally agree. And I think some of these come in, obviously for basic anatomy, the clitoris is in the sort of front portion or the anterior, anterior, but for our listeners, sort of the front portion, like of the
I
opening.
think
right?
he means up.
Up. There we go.
To the top.
Top. There you go. There you go.
For a layperson.
And some ladies come in and they complain of like that mound of tissue up top, and that would be your clitoral hood for anatomy, analogous to that.
Which is analogous to the penis.
Exactly
So
right.
again,
And the clitoris is the penis head, right?
Yeah.
And then sort of, we all develop from the same egg, right? From the same sperm egg sort of fertilization. So it's really, we all have the same roots, but it just evolves into a different organ, right? With the same sort of functions, which is always interesting, I think.
Yeah. That is amazing. Ideal patient.
I think the standard things, right? Healthy, no major comorbidities. We can do this procedure under local, depending on how significant it is. So that puts a lot of people who might not be candidates for general anesthesia and the realm of people who could have this procedure. But no major contraindications. Do you have any reasons that you wouldn't heal well? Do you have unrealistic expectations? Are you looking for something that's out of my wheelhouse?
Right.
I spend a lot of time. It's one of those consults that's a little different because I make sure I have someone with me. We lay the patient down. We get out a mirror. We really look at the anatomy, and I try to show them like, hey, I think this is realistic. I think this isn't.
Right.
And they need to know the limitations of what we can do reasonably and keep things functional and working well. I mean, you can over-resect. You can have, the vaginal mucosa exposed. You can cause chronic irritation, dryness, chronic lymphatic problems, and that's a whole, that can be disastrous for somebody.
You alluded earlier to, Dr. Gary, that you've evolved, in your opinion. Talk us through that. What does that mean?
So kind of like we mentioned before, I think in my training, this was not something we did a lot of. And then there was a little spike in popularity, and I was a little weary as to why all of a sudden it was trending. And I think it took a couple of patients coming in who I really kind of listened to and heard, and who did really well. And I always tell my patients, like, after 5 children, I feel like I can say this, like, the area is kind of meant to take a beating, take a licking and keep on taking. I mean, it heals so well. I think most labiaplasties, you can't tell they've had a labiaplasty. If someone else was just looking at them, I mean, I can't. I look at them and I'm like, I know I did this to you, but there's no visible scar.
It scars incredibly well.
Yeah, and
incredibly
so
well.
that sort of, I was like, well, this is like a no-brainer for patients who want this.
Right.
So now I talk about it often in conjunction with my mommy makeovers or abdominoplasty or other patients. I will say, I think urinary retention is higher in the tummy tuck labiaplasty combo for some reason.
You're talking about post-op.
Yeah.
Immediately post-op.
How does that make sense? Why?
It's just a lot more
You
swelling.
think
I think you could probably get a lot of swelling around the urethral meatus.
Yeah.
And you're combining that with a little abdominal wall and pelvic floor dysfunction from the tummy tuck. And
I was going to
those
say
patients,
guarding, like just
those patients probably have some pelvic floor dysfunction more than they know going ahead, at least the women that have a diastasis. So I think it's just all things combined.
And I'll be honest, this is where we're both great surgeons, and I tend to stay away from the labiaplasty tummy tuck combo,
just because of the swelling, right?
Because of the swelling and
Yeah.
the issues. Now,
Yeah.
obviously, we focus on different, and we had different patient populations. So, but to me, I think you're absolutely right. That is a concern together with the retention and
Yeah.
issues like that.
You were saying that as you started listening to patients and stuff like that. Obviously, this is a very vulnerable, surgery to like talk about, with a surgeon or stuff like that. What were you hearing from these patients that kind of made you change your outlook on it?
Well, first of all, they've done their research.
Mm-hmm.
Most of them come in knowing what they want or think they need.
Do patients bring pictures? Because I don't get a whole lot of this, obviously, as a man.
I haven't had any pictures.
I think that might be a turnoff that you're like,
Well,
Is there a
if you
picture? I don't know. That's what I'm
if you're
asking.
like, if somebody's
I
like
think it
obsessing
depends.
about a
Because with
specific
breast
vagina, that's
augmentation,
not.
I do
Yeah.
ask patients to bring pictures in what they're imagining
Yeah.
they
Right.
look like. So
Right.
just
yeah, I don't know. That's one of the, that could be a double-edged sword.
Yeah.
It
Yeah, no,
depends.
absolutely.
If they come in with a picture that
'Cause
seems
it-
reasonable, you're like, oh, okay, then
Right.
you have, but if they come in with, adolescent looking,
right.
Correct.
Yeah, but also like, where are you getting just like a slew of vagina pictures?
They're out there.
Hey,
Yeah, just
I'm pretty sure there's plenty of them out there.
Called the
It's just
internet,
like,
Brittany.
like, I know that, but you're like, what are you doing? Oh, I'm just perusing some vagina pictures to bring to my surgeon.
I think we need to
like-
get a vagina table book for the office.
I didn't know that
I
exists. That's
think
pretty.
so.
It's pretty cool.
I can't bring it home. My wife won't like that. So.
just on the coffee table.
But they come in with very
Yeah.
specific complaints. Like, look, every time I have my period, like my labia stick to the pad and it's really uncomfortable. Or every time I can't wear my Nike Pro shorts. I can't wear a swimming suit. Or I'm always uncomfortable during intercourse. And they've tried X, Y, and Z. It wasn't like their first thought was, I'm
Yeah.
going to go
Right.
in and cut off my labia.
Right.
And most of them, and then like I said, the other group would be the women who've had children who are just like, it didn't used to be like this.
Yeah.
Like this bothers me now and it didn't bother me before.
I think I'm going to bring this up because we're both surgeons and we work together. And so to me as a plastic surgeon, I think you go through training and you are sort of like, they try to transfer this knowledge to you, right? To be a plastic surgeon. But they also transfer some preset perception. Does that make sense?
Sure.
And then you go into practice and then you start to listen to your patients and you start to ask the why and the reasoning, and then you're like, what you thought would be a little bit outlandish before, you're like, that's
Wait a
perfectly
minute.
normal. Like this person, I'm in the business of helping people, right? And this person, this is a true insecurity, a true problem in their life, and I can fix it.
Right.
And to me, that's how we're both evolving, right? How we both evolve.
Right.
And that's what a
And-
good surgeon does, right?
And the truth is, we should be the ones fixing it.
Correct. We should be. Yeah, you're absolutely right.
Yeah.
We are.
We deal with more anatomy
Right.
in every part of the body
And precision,
and
right?
every age group and
Yep.
finesse and being meticulous.
Yep.
And I think
Are you saying that because OBs used to say that they should be doing labiaplasties?
no, it wasn't to set us apart so much from OBs. It was just, I think as plastic surgeons
Or general surgeons,
we are
yeah.
generally well
You're the-
equipped.
Yeah.
Yes.
Okay.
To deal, and then also when you talk about the complexities down there
Yes.
and reconstruction or
Yep.
gender reassignment or all the things, we probably have more training in that area than most. I
Yeah.
mean, obviously urologists and OB are down there a lot, but
Yeah.
when you talk about shifting skin around and moving parts and
Right.
trying to restore normal anatomy, like that's the business of plastic surgeons.
Yeah.
Yeah, and I think we are trained to deal. We do microsurgery. We're trained to deal with delicate, precise areas, and the labia has to be. I do my labiaplasties with loops, which is magnification, just because I know those skin edges, which can be deceptive because of the folds and the anatomy. They've got to be together perfectly.
Yeah,
I do
laxity,
I do
yeah.
eyelids with
Yeah.
my loops, and I do labiaplasties with my loops.
Yeah.
I don't do tummy tucks with loops on, but I think it has to be that precise, and I think
Yeah.
that's probably what separates us from OBs. I'm not bashing on OBs, but we are one of the few specialties where we are 100% surgery 100% of the time. We don't deal with like ICU management. We don't deal
Right.
with delivery of babies,
Thank
and that's
God.
why I went into specialty, right? It's because I love to operate, and so we learn precision and we learn the importance of that, right? And I think that's.
Yep.
I'm not trying to.
I mean, my ignorance is I thought it was a pretty straightforward, excise the skin,
Yeah.
stitch it up, and it's very far from that,
Yeah, this is
Recovery wise, is it a
talk
terrible
about recovery.
procedure
So
to recover from?
No, I think it's pretty tolerable. I think the biggest issue is everything's gravity dependent down there. You're going to have a lot of swelling. So it's ideal if you can kind of offload the area. You know, I tell my patients to prop up. It's kind of like men after a vasectomy. Like, you just don't want to be standing on your feet if you can avoid it for about a week. We treat it kind of like, for those of you who've had babies, it's kind of like that postpartum period where you're doing a peri-rinse, trying not to wipe a whole lot down there, keep things clean. You're going to put a little ointment on the incisions for that first couple of days to maybe...
Compression underwear?
I do. I like to kind of pat them up and wear some type of compression short.
Like bike shorts. Kind of, yeah, I do the same thing.
That's a whole cult thing with garments, but I tell them to go find some things ahead of time so they have some options.
Yeah.
But most of the time, the skin and everything looks pretty good by about a week, but you can have some swelling that waxes and wanes for several months.
And then stitches can come out when, or is it a dissolvable stitch?
I think it depends on, I'm sure Dr. Weiler
Everybody,
probably don't. Currently, I use all absorbable sutures.
I do the same thing.
Yeah, but
When can you have intercourse after?
in most patients, I say nothing per vagina for 6 weeks.
Okay.
So it's basically like birth.
No, I mean,
It's not nearly as significant as
I mean, like, you can't do
Come on,
anything
Brittany.
down there. Like, you can't do anything down
Right.
there.
Right.
Like,
Off
that's-
limits
it's
for
just
6
kinda,
weeks.
Yeah,
Yeah.
it's kind of just like after.
And that's just the way skin heals. At 6
Yeah.
weeks,
Yep, 6
a
weeks.
wound has reached, it's as strong as it's going to be. It never reaches normal, but it gets to about 75, 80%. So if you can give, and every week is exponentially different, right?
Yeah.
Week 1 is very weak. Week 2 is just a little bit better. And then all of a sudden it starts to,
get better.
Yeah.
So
And I think a lot of as surgeons, that rule can be bent a little bit, but I don't ever trust patients like Dr. Gear. And so just what she said, it's as healed as it's going to get at 6 weeks.
Yeah.
So like, my tummy tucks come in, I'm like, you can do whatever. Within reason, but because you don't know what people are going to do when they go home, right? So,
Yep.
you got to be
Right.
careful what you tell people.
Set
so 6 weeks
expectation, yeah.
is an excellent mark.
Yeah.
Anything you'd like to add as we?
I want to ask one more thing.
Oh, okay. I'm sorry.
Non-surgical options.
Yeah.
Labiaplasty does not fit into my life. I don't have the recovery time right now. I want to do it next year. What can I do to...
I think it depends on what they are looking for, right?
Yeah.
So if you truly have redundancy that's uncomfortable, there's not a great non-surgical alternative. If you have a deflated labia majora, if you have, redundancy that you just want things to be smoother, then I think filler or fat grafting are reasonable options. Of course, fat grafting is technically not non-surgical, but there's no skin being removed or excised and small incisions.
So you
There
could
is-
graft fat at the same time of doing a tummy tuck into the labia majora.
There is a
okay.
role for a CO2 laser resurfacing of the labia.
okay.
Now, you're never going to get a lot of shrinkage, but you can resurface them. I've done that. You can get a little tightening. You can combine that with the CO2 vaginal component to just kind of overhaul the vaginal vault and the external genitalia at the same time.
Do you think Thermiva tightens the labia minor?
No, that's a whole different discussion we get into. But I think you can improve some appearances. I don't think it's obviously, like Dr. Gear said, it's not dramatic, but I think the options are Thermiva and CO2 resurfacing. So we're going
Different
topic
day.
number 45.
Different day. Yeah.
It's like
We're
a
bringing her
facelift
back.
for your vagina. It's like a facelift for your vagina.
Well, look, speaking of facelift, I think a Mons lift fits in here because
yeah.
sometimes elevating the Mons improves the appearance of the labia or
I did one yesterday.
Oh, yeah?
So we were talking about that earlier. Yeah. So I totally agree with that. It does.
There's so many things that you can do.
There is. That's why it's important in my mind to, have all the tools, right? So go to somebody that can do the Mons lift, can do a labiaplasty, can do a majora reduction, can know what to do with the clitoral hood, can do, has a CO2 resurfacing, has a Thermiva. So there's a lot of different options there. You know?
Yeah.
I mean, any other questions that we have? I
Britt
think
is in astonishment over there. She's
always,
like,
every single
there's a lot
episode that
you
we
can
do, I'm
do.
just like, what are y'all doing? What do y'all do during the day? I'm like, I'm just here learning. I know this podcast was originally set up to like teach everybody, but I'm just learning things every week.
So fun.
That's good.
I'm like, this is where it's at. But no, if we don't have any other questions, Dr. Gear, thank you so much for joining us and letting
thank
us
y'all.
know. If this is you,
yeah.
find a lovely
Mary Gear.
surgeon
Located in Baton Rouge.
Yeah, like find a surgeon that does this, and it seems like you are very passionate about this, and it is helping, confidence, comfort, all of the things. So make sure you find somebody to do that.
Yeah.
Okay, of course, with that being said, make sure to like and follow and subscribe. And all the things. Do it.
Hit that button.
We are on all those platforms, all those things. I'm still planning. This is my retirement plan. So I'm like, make sure we get those. But no, thank y'all so much. Thank y'all so much for joining today. Remember to always stay curious, always stay informed, and always remember to consult before you cut. We'll see you guys next week.
Thanks, guys.